This is Salma Schimmel at the 2011 annual ASCO meeting in Chicago, and we are beginning our interviews with many of the most prominent key opinion leaders so we can bring you firsthand information directly from the source. I'm so happy to be able to welcome you now, Professor and Honorary Consultant in Medical Oncology, Dr. Christopher Twelves. Hello, Dr. Twelves.
Nice to meet you.
You are also the head of experimental cancer medicine at the St. James Institute of Oncology in Leeds, which is in the United Kingdom.
That's right, that's right.
Such an exciting time to be a researcher.
It really is, and I've been fortunate to be treating women with breast cancer now for over 25 years. And if I think back and break that up into 5-year blocks of time and think where were we 5 years ago, 10 years ago, 15 years ago, it really is quite dramatic how things have changed. There's been a stepwise improvement in survival, in the quality of life for patients, and the drugs that we give to control the side effects of chemotherapy. And when I see young doctors now, I'm afraid I indulge in some nostalgia and will tell them what things were like a generation ago.
I can tell you what they were like a generation ago.
Well, I think that's very important, because for many women who are diagnosed now, many of them, their experience of breast cancer will be indirect and will come from their mothers or their aunts. And I think it is important that people realize just how things have moved on from the earlier generation.
20 years ago, when you would sit down with a woman with metastatic breast cancer, the way you would have a discussion had to be so very different than the way you would have a discussion today. So how would you speak to a patient today, as difficult as it is to learn you have metastatic disease? Give me an example of the kind of very brief few sentences you would say to someone to inspire that sense of hope.
Well, I guess the two pieces of news that patients with cancer least want to hear, the first one is that they have cancer, and the second one is that the cancer has come back. And in many ways, in the setting of breast cancer, the news that the cancer has come back, if that means that the cancer has spread elsewhere, in many ways that can be the more difficult and the worst piece of news, because when most women are diagnosed, we're able to tell that woman that the hope, if not the guarantee, but the hope is that we can cure them of their disease. The situation when we tell a woman that she's developed metastatic disease is quite the other way around, and we have to explain to those women and let them understand that we can't cure their disease, but that we can hope, we can be confident to control their disease.
And also, every day that a woman lives, we do not know what new event can happen in the lab.
There's always things that are developing, and for many patients, I think one of the things that I certainly try and reassure them is that for the vast majority of women, when they're diagnosed with metastatic breast cancer, they're not in any immediate danger. I'm always very concerned that women may have a sense that the cancer is spreading through their body as they're sat there, that they're not going to make it to the end of the week, never mind the end of the year.
There's a real adjustment, and first you go through the mental part of just absorbing the shock, and you get your footing back. I believe once you realize there is a tomorrow and I'm waking up again, and while today is a difficult day and you're not sure what's going to happen from day to day, you do get your stride, you do get some confidence, and you learn to coexist, but you have to go through this adaptation period, and it is hard.
And every ache or pain or cough or cold, people very often are anxious as to just what this may mean. So we're always very keen, and we always reassure patients that if they feel anything is out of the ordinary, to come back to us so that we can look into this and hopefully be able to reassure them, or if we're not able to, then start getting on top of things again.
What I really appreciated about my interview with you is that you really showed us a very human side, not only on behalf of the patients, but about you, and that you see us as more than just our cancer, but that you take the time to go and to do the events and to want to see your patients in their natural setting, because cancer can be very dehumanizing, and despite your clinical focus, you've got a real human quality about you. Thank you.
Thank you very much.
Professor Dr. Christopher Twelves, Head of Experimental Cancer Medicine, the Center at St. James Institute of Oncology, Leeds, United Kingdom.
Thank you very much.